And we are now live, Senators.
Thank you, Alex. Good morning, everyone. This is Senate Health and Welfare Committee, and it is March 2nd. Today, we're going to continue our work going through S56 and looking at S18, another look at S25, and then we're going to take some time to understand the fiscal consequences and the administrative consequences of S9, which is currently on the floor from another committee, but may have an effect in our area of jurisdiction. So, Katie, welcome.
Thank you. Good morning.
Good morning. Well, I'll put it in your hands.
Okay. Well, Katie McGlynn, Office of Legislative Counsel for the record. When we last spoke, we talked about some possible amendments that the committee would like to look at. So I put those together and they are on the website, but I will share my screen and we can walk through them together. Okay, so this is Amendment 2.1. It's a strike all, and the new language is highlighted in yellow. So just to sort of refresh your memory where we are in the child care language, Section 2 is the change to the no copay or to the upper limit. This has not changed in this draft. You haven't discussed that piece yet. So that is still there. You still have this language about applications have to be in a simple, plain format, available electronic and paper. You haven't addressed that issue yet. And Section 3, this is the same child care language repeated again that takes effect 1 year later. This increases the upper income limit from 425 to 450. It's the same, you haven't addressed that yet. What you have addressed, and I've shown this as a straight through, but in a clean version, this would just all be pulled out of the draft. This was the language that had rulemaking for tiered professional compensation plan. We've removed instead that we'll look at in a minute. What is still in this draft, Section 4 is the payment to providers. This year is the change to be enrollment-based versus attendance-based. You haven't addressed that yet, so this has stayed the same. Section 5 is the same section as Section 4. It takes effect a year later. What is missing in this draft, or what is different in this Section 5, and is that earlier version, or the bill is introduced, amends subsection A and B. And I put the ellipses on line 16 to show that we're not changing those. I thought it would be confusing if I struck through the language. It would give the impression that we're striking out existing law, but what this ellipses say is we're not touching those sections of existing law. And you're continuing to strike through the link between CCCAP and the STARS program. So that's where we are. And then this is the new language that the committee discussed yesterday. So this asks for various recommendations on provider compensation and the total cost of care. First, in subsection A, on or before November 1st, 2023, the Department of Labor, in consultation with the Department for Children and Families, the Agency of Education, Building Bright Futures, and the Vermont Association for the Education of Young Children, shall develop and submit a tiered professional pay scale for professionals who provide child care services as defined in 33 VSA 3511 to this committee and Human Services upstairs. The pay scale shall be designed to provide professionals who provide child care services with compensation comparable to that received by early childhood educators in Vermont's public school system who serve children from pre-K through grade 3. The tiered professional pay scale shall account for professionals' credentialing and professional child care experience. So that's the first piece, that's the pay scale piece. The second piece is in subsection B. On or before November 1st, 2023, DCF, in consultation with Building Bright Futures and the Vermont Association for the Education of Young Children, shall develop and submit a formula to calculate the total cost of care to serve children in a licensed or regulated child care facility as defined in statute to this committee and Human Services. So that's the total cost of care piece. And then lastly, subsection C, these were additional recommendations for integration and for other states' sort of methodology for integration. So on or before November 1st, 2023, DCF shall submit a report to this committee in Human Services addressing the following: whether and how to integrate a tiered professional pay scale for professionals who provide childcare services as part of the Child Care Financial Assistance Program. Second, the structure of tiered professional pay scales for professionals who provide childcare services that have been implemented in other jurisdictions, including in New Mexico and the District of Columbia. And the appropriate legal mechanism to implement any approved tiered professional pay scale for professionals who provide childcare services, including consideration of statute, rule, departmental guidance, or some other appropriate mechanism. So that's just saying, are we doing a rule? Are we doing a guidance document? What is the best method of applying the pay scale? So that is sort of the big change we discussed yesterday. There are other changes in this draft. So scrolling past the places where there are no changes. Just little wording change on the transitional assistance for Building Bright Futures. To say including any plans to establish or alter a pre-kindergarten program in 829. So we're recognizing that there may not be the public pre-kindergarten education program as it is in the bill as introduced. And then we have some changes when we get to the governance portion of the bill. This version of the bill, this amendment, removes the Division of Maternal and Child Health as an entity that would be moving into DCF. It would continue to stay in the Department of Health where it is now. Trying to find where we're striking that. There it is. So this is talking about what departments and divisions are going to be in DCF if DCF is split into DCF and the Department of Economic Empowerment. An earlier draft said that the Division of the Office of Maternal and Child Health would be part of DCF, and this strikes that and says that the office will stay where it is. And then I'm getting close on all my changes here. You received language from the Bankers Association that had wanted updated language. And so the language is repeated twice because it is in the chapter, the existing DCF chapter, and it is also added in the newly created Department of Economic Empowerment chapter. So I'll only go through it once. Let's see where it is. Okay, here we go. Okay. So this is the new section that would be added in 2 places. A financial institution, when requested by the department, shall furnish to the commissioner or the commissioner's designee information for the possession of the financial institution with reference to any person or the person's spouse who is applying for or is receiving assistance or benefits from the department. The department shall issue instructions to the financial institution detailing the nature of the request and the information necessary to satisfy the request. A financial institution or employee of a financial institution shall not be subject to criminal or civil liability for actions taken in accordance with this subsection. Subsection B, each applicant for assistance or benefits submitted to the department shall contain a form of authorization executed by the applicant granting authority for the department and its authorized agents to obtain financial information about the applicant's assets from financial institutions in order to verify the applicant's eligibility for the applicable program. The department or its authorized agent shall obtain the applicant's authorization prior to requesting the applicant's financial information from any financial institution. The department shall ensure the applicant receives written notice in plain language explaining the department's electronic asset verification system. In the event that the financial information of an applicant's spouse is required to determine an applicant's eligibility for the program, the department shall provide written notice regarding the asset verification process to the spouse and shall obtain the spouse's written authorization for the department and its agents to obtain the spouse's financial information from financial institutions prior to requesting the spouse's financial information from any financial institution. The department may determine an applicant or beneficiary to be ineligible if the applicant's spouse refuses to provide or revokes consent. So basically, this language is requiring that the department would have to seek permission, explicit permission from an applicant for a program such as CCFAP or Reach Up prior to accessing that person's financial information to confirm their eligibility for the program, and that in some cases the spouse's information might be required, and that covers that, how that process would play out.
So we don't do this now. How do we determine eligibility?
Let's ask Miranda, do we currently do this for the bankers or the financial institution?
We do that we can get releases, but I would want to confirm that the spouse piece.
The spouse pieces, I thought new, so that's interesting.
Right, but I would want to confirm.
So when a family applies for CCFAP, what financial analysis is done to determine eligibility?
We get pay stubs. I mean, we get a lot of information from the families to determine
So
what they're.
how's this different?
I guess that's where I would want to be able to look at this language and see the comparison, if that's right.
So we'll look for your response to that. I know this is language or similar language when we were looking at adult protective services and how financial information is accessed and reviewed for vulnerable adults. So that I will have to hear from these folks and see how it jives. Okay, that's good. So these, okay.
There's one more change.
Yeah.
Apologies.
There's always one more thing.
I know. I'll just scroll to the very end here. And this is to show, so this is the same language repeated in a different section. But at the very end of the bill. Okay, this was a section on transferring rulemaking authority from the health department to DCF for the programs that are currently under the maternal and child health division. And so this section would be struck out, and then we have some conforming number changes in the effective date section.
Okay. Can we go back to, and this is our first shot through this, and I know we also have recently received information from the Child Development Division and recommendations or comments on the bill. We're gonna have to look at those. But the piece that we did look at yesterday on enrollment versus attendance, can we just go back to that and understand how that might influence some of the work that's going on around funding? We look at that section.
Yep, this is it.
Oh, there it is.
There
There it is.
it is. Yep. This is page 5.
And that's on page, what page?
Page 5, section 4.
Yeah, so it's the same page in the draft that we're looking at. I'm actually gonna keep working with this draft until we have more markup. Okay. Go ahead. So why don't we walk through this a little bit, understand what it is?
Sure. So this section has to do with the CCFAP payments that go to families, to providers on behalf of families, and how the payments are calculated. So existing laws that the commissioners shall establish a payment schedule for the purpose of reimbursing providers for full or part-time childcare services rendered to families who participate in the program established in law, so they're referencing CCPAP. Payments established under this section shall reflect the following considerations: whether the provider operates a licensed childcare facility or a registered family childcare home, type of service provided, cost of providing service, and the prevailing market rate for comparable service. Existing law says payments shall be based on enrollment status or any other basis agreed to by the provider and the division. So this proposal is to get rid of that language about any other basis agreed to by the provider and the division. In this case, that would mean attendance based. And this directs that payment shall be based on enrollment.
Okay, so I'm going to ask the question about what effect, how can we determine the effect on payment to families? How is this going to happen? Thank you.
Happy to share. I don't know if I should say, for the record, Miranda Gray,
Sure.
Deputy Commissioner of
Thank
the
you.
Economic Services Division. So right now we're running analysis, and that looks at within our new IT system. What it looks at right now is we have a set amount of vacation days and sick days that families have access to. And essentially what this would be, and which it is that the state will pay programs for children that aren't in attendance because they have sick days or vacation days. But this moving to enrollment would say that the state pays regardless of the child being in attendance. And so that is what we're looking at, that analysis right now. It's like there could be, more than likely, there is a cost to the state on that.
But when is that, when do you think that will be completed?
So March 30th is when we have.
So I guess the question for us in here, March 30th, is after crossover, and after the bill, hopefully, after the bill leaves the committee. So, so the question I have is, how do we integrate this into what we're looking at for payment? And I know we've heard this the day before, but I just wanted to clarify first. So it's just simply a question, is this like, this is a policy decision about maintaining enrollment-based versus attendance-based. So we can make that policy decision. We won't know the consequences of it until after that information is made available. Senator Hardy.
Yeah, so I don't know that we've heard specific testimony about this right now, but we've heard a lot of testimony in the past
Yeah.
from childcare providers who are trying to, make their budgets, and they budget for the number of kids they have enrolled in their program. And then they receive lower payments because it's traditionally been payments based on attendance. So, they have to pay their teachers to come, they have to have their doors open and their lights on and their food there and all that stuff, regardless if the kid is sick or not. And so my preference would be that we leave this as it is, because our intent is to try to help childcare providers maintain their businesses, and that, the House can make adjustments based on what they learned from the report on March 30th.
Sounds good. Senator Weeks.
Do we at least have any information on the delta between enrollment and attendance, just to kind of see if it's a significant issue or not?
That's a question for Deputy Commissioner Gray.
So do we have any information on the difference between attendance and enrollment to see if this is significant?
That's what we're analyzing right now to be able to determine. And then there's also other consequences that could come from moving to an enrollment phase, such as having to make sure that programs aren't holding a slot indefinitely when we know that we might have a wait list of children who get it, because they would be continuing to receive money for that slot regardless of whether a child is attending a program or not.
Yeah, so this is a good question. So once that information is available, there might be some guidelines that are put in place around number of times a child is absent, or how long do you keep the slot open when they're enrolled but not attending. So there's a lot more decision making here, but currently, I think it does make sense for us based on all the testimony we've heard over time. Thank you, Senator Hardy, for reviewing some of the interest there. The enrollment will help our child care centers stay alive. And the administrative burden of attendance is really amazing. It doesn't mean it won't still happen. I don't know what the rules or the guidelines will be around this, but enrollment seems to be a benefit.
I love that you use Delta.
Yeah.
I just have to say that for a change.
Yeah.
Do you also write the triangle, the Delta triangle when you're taking notes?
Delta.
I love that.
I like Delta.
Can I add-
I use it all the time. Yes, Katerina. Yeah, go ahead.
So Katerina Lasias, Senior Advisor to the Commissioner at DCF, for the record. I just wanted to remind the committee that last year we did increase the number of closed days for providers and vacation days for families. We doubled them. We moved from 15 provider closed days to 30 provider closed days and 10 family vacation days to 20 family vacation days, which is part of the analysis coming at the end of the month. Oh, Miranda may have a further update.
Right, and just, and to note that.
Yeah.
Owning a friend. Unlimited, we also offer unlimited child sick days with verification from the parent or guardian that the child is sick or has a medical appointment.
Good.
From what I
Yes.
fairly
No,
generous.
I mean, what's going on is a very fair process. You know, it may change. There might be some changes as we move to enrollment. I am sensitive to kids who need to be out with doctor's appointments.
So first off, I acknowledge the Senator Hardy said about keeping the doors open, reserving slot. I totally get it. I'm just wondering if it's appropriate in the committee to actually reach back to an old testimony to see if a provider gave some information about the Delta. Just to kind of say, okay, it's a non-issue, it's a small amount, it's a small, we can move forward so we can beat the crossover date. From having at least a sense that it's either significant or it's.
I think some of the reports that we've received have that kind of data in it. We can go back and look, but I think some of the information is probably already on our webpage just because we have taken so much testimony. But we'll look at that and make sure that your question is answered. And we do know that we've asked for this information. So this has been an ongoing goal and policy for us. So it's not like we're starting all over again. The only question is, do we leave it as enrollment or strike that last clause, that really like this, but any other?
I'm okay with enrollment. I get it.
Okay. Yeah, I think there's a huge amount of data that supports that. Yes.
For the record, Noel and I will respond to this. The only, well, not concerned, but one thing I would flag, this is the report won't be out until March 30th. I may not have a number, which makes it hard for me to put something in a fiscal note, which then affects the financing. So I'll probably come up with some number of some sort, but please know that it will be wrong.
I know, and this is why I went back to here, because I know it's going to influence any numbers that we get from you.
Well, I'm thinking for the finance committee. 'cause that's
Yeah, the
amazing.
finance committee is going to have to live with.
I really feel like we had some kind of basic information on this when we talked about this issue for so many years. I mean, Sarah, do you remember, or Miranda?
I think the report was originally supposed to be done last spring. So
Yeah.
I think I don't know that we've ever had the report before about attendance versus enrollment. I don't know.
No, but I mean, even just on a sort of more limited basis that we could extrapolate from.
I'm not sure if sorry.
No, I just feel like we've done it before, at least on a limited basis, but
During the pandemic.
Yes.
We provided childcare and it was limited. It was for essential workers. And I think at that time it was like doctors, nurses. It was very
Yeah.
tightly,
Yeah.
described on who was getting it. So we do know like what that financial impact was for that amount of weeks. And I think that we might also be talking about people that weren't typically eligible for CCFAP. As well, and I guess I should just note that we are talking about for the enrollment, but CCFAP only serves 20% of the population. The other 80% that are using childcare are outside of.
yeah.
And, you know, the other piece of this is consistent with the way public school deals with kids. You don't look at their attendance and then subtract the amount of money that goes to the public school. So we'll, and I'm gonna ask myself, go through and see what we have that might help answer some of the questions. And any of you who are here around the room who might have data to support this would be very helpful. Because I know we've been through it. Okay, so so is there any, at this point, my suggestion is to leave that the way it is, the way that paragraph exists, 3514. Striking that last phrase and leaving it
Thank you, sir.
committee, that's my suggestion. Is there anyone who would like not to do that? Looking at my committee.
I'm sorry.
I'm
What did you just say?
suggesting that 3514 remain as it is with that last phrase.
Yes. Agreed. Thank you, Madam
Anybody
Chair.
who wants not to do that, let me know. And Martine, you're out there. Are you okay with that?
I am. Thank you very much for asking.
All right, good. Well, I know you're there, and it's important for you to help us with this, so thank you. Okay, we're good. Okay. All right, so the other issue is that we have received CDD information, and I want to check in with you, Miranda. Is there anything, Deputy Commissioner or Commissioner? I'm okay. Any comments on that, if any, or do we need to just take our time and go through it?
I believe we just tried to provide information that the committee had asked us over the last week, and specifically giving some language around the special accommodation grants. And then otherwise, it's really just trying to highlight where we see that there's a IT impact and being very forthcoming about what that means for us in terms of like where the deadlines stand right now for the certain sections of the bill.
Make a suggestion. Yeah, I'd like for you to come up here and perhaps share your screen, and we can go through that memo that we just received from CDD and help us understand the effect, if any, on the bill itself. Child Development Division. I said it before, but you know, it just goes, I know, it just takes. Okay.
I don't believe I have the Zoom link yet.
Adjusted.
Okay, thank you. That's why I assumed that's what you were.
Okay,
working
we
on.
have it on our own screen as well. But it'd be great to look at it together.
Even though we're sitting, there we go.
think what we'll do is after we go through this and we'll try to get into discussion on the CCFAP for some preliminary decision making, at least then after looking at Joyce Manchester's graphs and which one we think might get going forward in terms of percent of poverty, and how to attenuate the cliff.
Did it just kick you off?
It did, or maybe I was trying to not turn the volume so I didn't create problems. Perhaps that created the problem.
I don't want to keep going. You know, while we're having this little hiatus, I'm gonna ask the new who's here, Mr. Stuff. And you don't begin, you can let us know what your status is.
Absolutely. So hi, everybody. I'm Janet McLaughlin, and I am maybe the Deputy Commissioner of the Child Development Division as Miranda steps over into Economic Services. And I am sort of doing a couple of days of orientation, like yesterday and today, and then next Wednesday, the 8th, is when I will officially be in my role as Deputy Commissioner. So I've been working in the state in nonprofits for the last 10 years, including the last 8 years in early childhood related organizations. So excited to be part of the state and part of the team working to advance these issues.
Terrific and welcome. And I'm sure we'll be seeing a lot of you in here.
Yes.
So it's nice to have you getting used to the environment.
Yeah, thank you.
Miranda cannot wait.
She's been wonderful. Give me a nice warm handoff. One hat will be good.
Still gonna CC her, all my requests, just for. Yeah.
We'll still get to connect a fair amount, Nolan. Housing, maybe.
Oh, yes, here we go.
Okay,
All right.
thank you. Again, for the record, Miranda Gray, I'm the Deputy Commissioner for the Economic Services Division. All right. Sorry, I am now experiencing the same challenges that I saw with this. So we wanted to take the opportunity to share, and once again, I did by section, I believe that these still align with the sections of the bill. So the first section, it was the section 2, the Child Care Financial Assistance Program, the eligibility, and just making sure that we are to note that I believe currently moving from 150 to 185% of the federal poverty level. This is an impact to our IT system. Currently, this is not what is programmed. And we would need time to be able to look at what that programming would take. We believe probably with, if this component of the bill were to pass, I believe the start date is July 1st, and that would be a challenge for us. We think perhaps we could do it by October. But even that could be a stretch depending on how complicated this was for our vendor to do. So just wanting to make sure that we were upfront about that. And then also in the section is the piece about having an electronic application. We know that we wouldn't, that isn't something that we have currently. It is something that we desire to have. And so we wouldn't have that ready for a July 1st deadline either. And then it's just with everything, if we are to pivot to working on this technology, that means that there's other things that we already have set up that we wouldn't be doing, which also extends out our deadline and also has a fiscal impact because this isn't currently work that we have our vendor working on.
So question there, I mean, we could certainly say that July 1st is the implementation date for the legislation, but that no later than a date for actual implementation, we could say something like that.
And I guess it's just flexibility of knowing that sometimes because we have launched a new IT system and we were not able to meet the deadline that people had set for us, we were going as diligently as we could, but we can only do as much as we can. Some of it is outside of our control.
Okay. All right. Good question.
The application that's not, I think I heard you say before that you didn't think you could do it at all. Is it just a timeline thing or is it an actual?
The timeline is not a part of this current module, so it would be an additional ask, which means an additional scope of work and expense. And as well, it would have interplay with another IT system, so it's and ones that haven't been connected to our current IT system. So we just don't know exactly how complicated that is.
Just put future effective dates for these things too.
Okay,
We talked about this yesterday. This was just looking at the compensation
Right.
standards, so I don't think that we need
we
to.
probably don't.
Yeah, we
probably
need to
can
go
skip
there.
over that one, right?
Yep. We also don't need to go into the next, which was just, we just talked about this, the
Yeah.
attendance versus enrollment. The non-citizen childcare program, I believe, we talked, but we didn't necessarily specify. We have looked at what this lift would be for us, and we are giving an approximately 6-week timeline to be able to do the programming, testing, and deployment. So that would be in addition to our timeline now, which would push that out like completion into spring 2024, and that doesn't include if you were to add in like the previous pieces that we were just talking about, the online application, etc.
I think this section of the bill there's a buffer year where you're supposed to do all this stuff and the program doesn't actually start until July 1st, 2024. Isn't that right?
We did talk about that before, yeah.
Yeah, so if that's spring 24, that's fine. That's actually what the timeline that's in the bill. Yeah.
Yeah, I think and then it just becomes, it's a fiscal impact of, because this isn't within scope of our current project.
Oh, I see.
So we would need to ask the vendor to put it in scope and what that expense would be.
Okay, so it's more of a money, not a time thing.
Yeah, it's,
Okay, got it.
other than that, was there are other people that we want us to be done with our module 1.
Yeah.
All right, section 9, the special accommodation grants. So we appreciated the opportunity to be able to provide information. What we wanted to share is that we have asked Building Bright Futures to help us analyze the data that we have around special accommodation grants, like how long are children needing them for. What we know is anecdotally is some kids really only need a few weeks, maybe it's a couple of months to be able to get integrated into a child care program, where others might need what we would consider to be like a one-on-one that a child might get in public school settings. But it's anecdotal. We haven't had the capacity within our team to really look at like what are the needs. So we have that coming. That is due to us September 30th. And then we just have some suggested language to give us that flexibility, because I think one of the requests was to move to a 12-month grant cycle. That might not be appropriate. And we hope with having this data, we would be able to then put that forward to say, here is what we're seeing, and we might want flexibility. So that to not say that someone's going to get 12 months of a grant if they don't really need that level of support, or yes, we find that most people do. So we have for under the 1, the appropriateness of moving to a 12-month grant cycle, and if so, for which populations. Sorry. And also just if you don't like appropriateness, we can try suitability or usefulness. And then for any other proposals the department deems essential to the goal of streamlining the application process for special accommodation grants.
Okay, questions about this? Any questions around this? So suitability or usefulness?
What section of the bill this is?
It's 9 on page 10, section 9, page 10.
What page is on?
Page 10.
Page 10, okay. Oh, yeah. Okay.
Appropriateness, how about feasibility of moving to
Suitability,
feasibility?
feasibility? suitability?
Suitability?
Yeah.
That feels like a word we don't use in the statute that much. I don't know. how it feels much.
Feasibility is, might be okay. What is the, what is, Martine or Senator Goulart or Senator Weeks or Senator Williams, I mean, your thoughts here about wordsmithing?
I'm an anti-committee wordsmither.
Oh,
Uh-oh.
Not efficient.
it's definitely not efficient, but it's often what we are doing.
And I do have another question as well. Is there any reason, oh, it is there. Well, okay. I was looking at for CIS and it's right in front of me. Children's Integrated Services. Okay, that's good. All right. So let's say it's either feasibility or suitability. And I'm not, which one fits better from your perspective?
I do think it's suitability. I mean, feasibility is like, it is feasible.
It is,
So we could do that.
Is
And
it
then there are
suitable?
some constraints just in terms of it is complicated for us to cross funding over different state or fiscal years, depending on the funding source, which we have both going into special accommodation grants right now. But it is we want to make sure that we're actually meeting the need that is before us. And it might not be that every grant needs to be 12 months. It could be 6 months. And what we have done to address this now is, I believe we're at this point of like, if we know someone needs this for 6 months, what we offer is the ability to amend the agreement. So it could go another 6 months. So it isn't going through the full grant process again, which is laborious. It is more just saying like, we're going to check in and see like, does the child still have the needs? Does the program still have the needs? And if yes, then we're going to do a quick amendment and you'll have this for an additional period of time.
So, which one?
I don't know. I think
Okay.
it seems to me, the point is that the process right now does not work for families and childcare providers, and we need to make a better process. And that what I hear from them is they have to reapply all the time for these short blocks of time. And it takes up a lot of their capacity for a small entity. So,
Which is why I like suitability. I mean, for that reason, we've been looking at this for a while, so.
I mean, a student,
And I don't care.
as long as you
I-
understand the intent of what we need here, you know, it needs to be easier.
Okay. And we-
Especially because these are really vulnerable kids.
Absolutely. And that we have been trying to make tweaks over the
Yeah.
last 2 years that I have been there. It's like, how can we make this? And we keep making incremental changes and with the hope that it is making it easier, as easy as it can be when it's a grant process.
Yeah, no, I hear you. And I know you have tried to make it better. And one of the reasons why there's a report in here instead of language is because we didn't know how to make it better either. So to be fair, suitability is fine, so we don't have to spend more time on this.
Okay, let's do it. Go for it. And then what about number 4? We're okay with that. Streamlining the application process seems like a good thing to do. Okay. Well,
Section 12. So this was a question that was raised, I believe it was last week, was just, there was
Oh, yeah.
curiosity about how much has the state been putting into the current student scholarships, and that is $150,000 through the American Rescue Plan Act funds, and through Act 45, we had added an additional $300,000 to this program, and then we currently have language in the BAA to be able to make money that was going towards the prospective student scholarship program, which unfortunately was not working, more flexible so that we could move it into this program so that we could support more students who are currently working in childcare programs. But I just thought for the basis, when ARPA goes away, we are looking at $150,000 that would go into this program.
okay.
Just curious, so it looks like roughly 450,000 has already been dedicated to these scholarships. Any information on usage? Are we saturated or are we?
We were able, and actually I have my phone, a friend over here who will be able to answer how many more students we've added since adding the ARPA funds. Yeah,
Make sure you state your name for the record.
so again, so Janet McLaughlin, Deputy Commissioner for the Child Development Division. But I am very familiar with the Teach Scholarship Program based on my last role. And so with the additional ARPA dollars, we were able to add bachelor's degrees to the Teach Scholarship Program. We probably moved from having about 50 early childhood educators enrolled in the program to about 100. We are, when we did the analysis last November, sort of looking to the spring semester, we were looking at maxing out that funding, the total funding that was available. So also in there also is non-ARPA CCDF funding of 128K in there. And so it's 578. It's been with the ARPA dollars is what's for teaching. We're looking at maxing that out right now. So I would expect that the need in the future would be closer to that amount. But right now there's ARPA dollars available.
Okay. So, I mean, so the difference here is between the delta, between 300 and 500, so $200,000 difference, but, it sounds like with the end of isolation and COVID, that this might be accessed more.
Well, even with COVID, they
Even with
maxed out.
COVID, well,
So
I
I think that,
understand that, but with now taking the cap off of COVID,
right,
see more people, so I'm happy leaving the $500,000 in. And this would be our recommendation. Obviously, the budget will have something different. We don't know what it will look like when it gets here from the House. But it is a discussion that appropriations can certainly have. There's a long road between now and final decision making on that one. Yeah.
Just a curiosity question, are these full scholarships or partial scholarships?
Is it a range
Janet question.
of scholarships?
It does fully cover tuition, but people do have to use their financial aid or other sources of funding first before the Teach dollars kick in. And then there's other supports as well. There's some supports for to cover books, to cover access in terms of internet costs, to cover and to work with their employers to provide a little bit of release time.
It's been a real move.
Yeah, I think given that this speaks to the quality issues too, by improving the quality. Yeah.
Okay. So unless I hear any. I'll leave it. All right, okay.
And then I know, I'm sure that you had asked about the governor's budget, so I just put that
Thank you.
in here for you as well, so you have what that includes.
Let's see what that is. So that the 400% expansion of CCFAP would be, you're calculating 41.5.
Correct.
And is that based on 22 or 23?
That was based on 22.
Okay, so yeah, so 23, family of 400,000, family of 3 of 400,000, 99,000 for 4. So this, okay, that is 4. Okay. So it would be more, no, did you want to comment?
No, sir.
Okay. All right.
Then we have the equity payments, which is moving to paying all providers at the 5-star level at $4.9 million.
Okay,
The school age subsidies, so this $7 million is targeted at paying, it's CCFAP for school age children, so helping families and children afford after school summer care, school vacation care. What we know is based upon using the free and reduced lunch data pre-pandemic. Now, y'all know what's going on with the meals there, but we believe there are about 5,500 children, school age children that are eligible for CCFAP that we aren't supporting right now. So that is in the budget.
And then along with increasing the eligibility, we have included $2 million to go to our community childcare support agencies. They are the agencies that help families find childcare as well as determine eligibility for the childcare financial assistance program.
So this $7 million, I'm going like that.
Yes, of course.
This is not the same $7.3 million that's in our bill.
Correct.
This is the after-school program that I understand is being considered in the bill in the House and is currently in the budget.
So yes, all right, yes.
Yeah, okay, so that's not in our bill. And then, but this is helpful for us to understand what's out there in the budget.
Yeah.
And then the next one.
Yep.
Go ahead.
I'm sorry. So the next one is the eligibility and referral that increased to that, those contracts. So just knowing if we are going to be bringing more families in, then we need to have the workers available to process those eligibility determinations as well as help families find childcare.
Okay.
And then last is positions. So we are asking total for 6 positions for the child development division, one of which would sit within our business office.
And this is all in the budget.
Yes.
Right. We don't have this here. But how much of the need for new positions is based on changes to what we're doing here with the child care?
It is all
It's all
integrated.
integrated.
It is. Anytime we're, oops, sorry, go ahead.
I was just gonna probably say what she's gonna say, that I'm basing all of my estimates on them. So like, I'm building off of there, so they have the 41.5 go to 400. All my estimates going from 425 to 450 are on top of their proposals. And I assume the 2 million, because they're hiring people to do the work for the expansion.
Okay, this is good. I think it's important for us to understand that, and what we're doing here will have implications in any decisions that are made in the budget. Not occur. Okay. Go ahead.
Yes, so it's fundamentally, requiring new positions, et cetera, to deal with an increased population of that we're servicing with these CCPAP benefits. Is that kind of the nature of?
The question for Deputy Commissioner. No, it's good. It's a great question.
So you're increasing staff. Okay, so basically the logic is because you're increasing the number of citizens that we're providing childcare services for, correct?
Correct. Yes, and would that become the need for, oops, sorry.
So how many, what's the delta, what's the anticipated growth from the number of kids, students that we're projecting to what we provide services for today via CCPAP to where we, to the expanded levels? How much saturation into that unserved population do you think we're really going to hit? What's the assumption? Because you must have said, okay, look, we need 6 because the growth is this, something.
Yeah, so we're anticipating with this about 5,000 more children within that 400%, and then targeting within the school age the 5,500 more children. So, just
Are
roughly.
there only 9,000 total? Isn't the population that we're, the whole population?
It's about 5,000 children per age group.
It's not so much that you're increasing kids under the CCFAP envelope. Okay, so the cost goes up as you increase which kids are covered.
Okay, I get that, but isn't the total target, I'm going way back to the beginning, the total target of kids is 9,000, 9,500, something like that. Isn't that the number?
No,
What is it?
it's about 5,000 per age. So 4-year-olds, 5,000 4-year-olds, 5,000 5-year-olds, 5,000 6-year-olds. That's really rough, but
Yeah. We have that. They gave us that.
so if you're looking at school age population, there's, a big range of, it's 5 to 12, I think, for school age. And for each
age group under 5, it's 5,000 per year, more or
So
less.
thank you.
Yeah.
So, because I had that. So, what's the further saturation into that population per age group that you're anticipating?
So I don't have it per age group, but saying like moving up to the 400%, we're looking at adding an additional 4,600 children. And then within that $7 million for school age, we're targeting being able to serve, additional 5,500 children.
Total all age 0 to
13. School age goes up to age 13, and then higher with special needs.
the CCFAP is not.
CCFAP covers children that are school age up to age 13
For after-school programming.
Oh,
Yeah, after,
in summer, which is quite expensive for families.
even more. Any other comments on that? Are you okay with that? Okay. And just, we're gonna go through this, then finance committee will go through this, and then appropriations will go through this. And the same as will be happening on the other side. Legislature. There will be lots of these sort of questions asked and hopefully answered. Okay, anything else there from you?
The last piece, I believe the committee had asked about like, how do we incentivize quality without stars? I don't know. Here are just some additional thoughts. It's not language per se, but this is just sharing like where there are still incentives, some of them financial. And then others are supports that we're providing for childcare programs, realizing that people want to have high quality programs. Right now, it might be that they don't have the capacity to do so, or they don't know how to get started. And so we are putting in our quality coaches. Those will be folks that can help people, like, what is your plan? And here are the steps to achieve that. And then we also have the Children's First Finance, who will be providing business technical assistance. So really helping programs financially kind of look at their situation. So this is how we have been targeting how to support programs so that they can keep a high level of quality. Recognizing like that is a selling point for programs, is to have a high quality program to bring in families.
So the quality coaches, you're increasing that support for centers. How many of those quality coaches are currently in the department division? And how many are going to be a result of the hiring process that is?
So the quality coaches is a grant agreement that we're currently in negotiations with. So they,
Okay.
this
So it's
doesn't
a grant.
exist. Yes.
Is it a federal grant or is it a foundation?
This is, we are starting it with our American Rescue Plan Act funds, and then also have other funding to be able to sustain this funding beyond. So it isn't in existence now. This is something that we had learned through Act 45 of what did the field feel like they need for support. And so,
So I guess the question is, what, if anything, do we put into this particular piece of legislation that would encourage this type of activity to take place? We don't need to name necessarily quality support specialists or other incentives, but I think it might be important for us to have a sentence in there that says the department shall explore opportunities for incentivizing child care quality improvement. We could say that. Would that fit? And it would keep you moving forward on this. And then we'll have to think creatively ourselves ultimately about how to help them make that happen. And as assuming we went forward without the STARS incentive in place, then we have to look at what are the consequences of having that in place, if any, what changes with the support services you're offering, do we see improvement? So that there might be something that we'll be asking for an update on this. I'm not necessarily looking for a report in this legislation, but some kind of an update on the effectiveness of any new incentive programs. So there are two sentences in there. Yeah, that's my thinking. Others add in. And I'll look up do you want to finish off? or
I
you
am
good?
all set, thank
You're
you.
good. This has been really, really helpful. Appreciate the time that CDD has taken to bring us this information on many different levels. Very helpful. And Senator Gulick, I'm turning to you and see if you have any questions or comments at this point.
I am good. I'm following along and thank you.
All right, thank you. Okay, good. And committee, any questions for the deputy commissioner while we have our captain? We're good. Thank you. Katie, I'm hoping that you can. I know, also, this is great. Okay, so let's, Katie, why don't you come back? We still have some time. So we'll be able to see some of those changes go, that we talked about, dialogue about a little bit.
Okay.
And, but I was thinking that we have Nolan here, we have Katie here. And I'd like to go through, talk about the actual CCFAP percentages, where we go in 2024, where we go, what aspirational hopes we have for succeeding years. And where are, and I see that checklist, where are we on our decision? Let's look at, can we start with this and then we're gonna move to looking at things that no one's.
Sure.
Is there anything more on this list that we need to address? We've done a lot. Let's talk about transitional language for system governance. I'm gonna hold that thought for a minute. Katie, you're in charge of this.
Oh, I'm in charge, okay. So, I mean, the big piece that you still have to make decisions on is that first bullet on CFAP.
Yes.
What is the scale that you're looking at? And when do you want the different pieces to take effect? So
Okay.
that's probably the biggest decision point you have on your.
Yeah,
plate
we
right now.
probably should address that. And what is there, give us the check off of what else?
So you addressed workforce compensation in the pay scale yesterday.
Yeah.
I don't know if you have changes to that language that we went through. For that is one piece that you've addressed. Payment to providers, you've addressed enrollment based.
If we're saying we've addressed it and we agree, you'd like to back up.
We're not, we haven't agreed anything. All we've done is addressed it, and we're going to have language that we're going to go through as we go through final markup of the bill. Yeah. Yeah, no, we aren't there yet. No, don't panic yet.
Right. Paying attention.
I know you are. That's great.
Okay, so payment to providers, you addressed the attendance and enrollment based question. Today, you have that language about total cost of care that we ran through quickly this morning. The non-citizen child care assistance program, we've walked through it. There was, Nolan brought up that you might want to factor in money for outreach, if you move forward with that. Today, we talked about the special accommodation grant, and there was new language that you've asked to see in the bill, so we will add that. In terms of the workforce programs, we talked about it. At this point, I haven't heard any substantial changes. That's sort of where we are in those pieces. The property tax exemption, I'm not sure if you're gonna address it all in this committee or. if you're
I don't,
saving
no,
that.
I don't think so.
Okay.
I brought it up in finance yesterday when I
Okay.
presented the bill, and they, obviously Senator Cummings was thrilled to see it.
Okay.
Yeah.
So I will save that to discuss with them. And then we have the governance piece. We looked at that language a bit, in terms of moving around the maternal health piece or moving it back to where it currently is. in terms of whether you want to make more decisions on that piece. I don't know. The financial language we went through today, the banking language. I ran it by my colleagues who typically deal with banking issues, that's not me. And they suggested that we run the language by DFR. So if that is okay with the committee, I'm going to send language to DFR to get their feedback on it.
Excellent. Yes, we gotta do that. And then why don't we do this? Why don't we come back to this section of transitional language may be important here. I think we did talk a little bit about, where did we talk about? We talked about transitional language up above the workers' compensation piece, but we probably should talk about the governance transitional language in, why don't we do that tomorrow? Why don't we take a minute to do that tomorrow? I think while we have no one here, it might be helpful to look at the CCFF. Yes.
Related to governance, the thing that I don't quite understand yet, I take a look at a problem, I try to take a look at the solution. So I try to figure out where we are, and where we want to go. I'm not quite sure I know where we are. I'm not quite sure though where we want to go as far as the continuum of education from 0 to and even adult education. So I'm not clear on which agencies have which responsibilities, and if it's possible to just get even a whiteboard overview. This is where we are. This is where we want to go, and this is why. It'd be really helpful to understand because we're setting up a new agency.
No, we're transferring pieces and parts, and we're moving childcare into. Yeah, so, so can I make a suggestion? We're gonna have this conversation tomorrow. In the meantime, we do have an AHS chart that we got a long time ago. And we also, you guys in education, have the AOE stuff. And then there is the report that came in this summer regarding governance, and that we have that on our webpage. So between now and tomorrow, I would highly recommend just reviewing that, and then if there are continuing questions, we can get those answered as much as possible. But I understand I understand what you're asking.
I'm just trying to get my head around the
Yeah.
establishment of the report.
No, it's a big thing. It's not a
It's
little
a
thing.
systems analysis report, and I'm happy to talk to you outside of committee about it.
So
Okay. Yes, sir.
Very good. Yeah, just one last question. So, at some point, will we get a summary of total costs? Well, the fiscal note or whatever the right term
Yes.
is that? Okay.
Yeah.
Just complete, add, subtract, in the end.
That's where we're headed.
Okay, thank you.
And then whatever our job in here, policy decision, what's gonna work best for kids, families, childcare centers, and the agency, they're a big part of administering all this. And then we get that information, that's a policy decision, that we look and see how expensive it is. We might modify it here and there, but then our policy down there. Yeah, no, all the questions you're asking are really about our target. Okay, so.
Weeks the right mental talk, I think so.
Oh.
That's scary. No, I mean, I don't know what I don't know, so.
No, it is.
You have the institutional knowledge of where we are. I see where we want to go, I think. But the only question I got is how we get paid for it.
Yeah.
That's not our problem.
Well, it is somewhat our problem. We don't want to go sky high, and we don't want to be too low. I mean, we really do want to look and see what can we do to take this whole process forward, because we have been working on it now for a number of years. Act 45 is one piece of this. Act 45, which we did last May, it's just one piece of it. So I think we should look at CCFAP. We have no one here from up here and talk with us.
Okay.
And we had that report from Joyce yesterday, that was terrific. So one of the suggestions right now in the bill, Nolan, why don't you come up and then.
It's not here a while.
Oh, good to see you. Thank you for being here. So, for the record, and then what would be helpful is for you to talk about your interpretation of what we heard yesterday from Joyce Manchester and what is currently in the bill in terms of 185 or.
And also the other thing I would like to flag too is what Commissioner Gray just talked about on the zero copay, the date. So you might want to think about that too.
The date for when they can get this work
Yeah.
done, yeah.
Yeah, I think we should just change the effective date to January 1st, 2024. For that,
For which,
for the zero copay for 185, we keep that in the bill. Because what I heard Miranda say was they could maybe do it by October,
October
but
was-
probably not, so why don't we just give them?
well, I was gonna
January
say,
1st?
you know, effective date July, get to work on it, but then you don't.
I think usually you say no later than and you do
Yeah,
January.
that's, I like the no later than idea. Work for you, if it were January 1st, everybody's gonna be working on New Year's Eve.
I don't know that
No
we
later
usually, we
than-
don't usually have no later than effective dates in bills. It's
No,
usually-
I wasn't putting that in an effective date, I was putting that in as a part of the paragraph that would say, no later than.
Contracts, yeah. Senator Hardy's right, but you might want to do January 1st, give them
I
time.
was just going to say, I didn't want that as an effective date, I did, but I'm open to that conversation.
Would you,
Katie,
apologies, would you still be doing the change to the ceiling before whatever number
We're
you're
gonna
on?
get there.
yeah,
Okay, but would that be the same date, January 1, or would that, the reason I'm asking is because I just want you to know, when you see the next draft back, we're gonna have that section repeated again with a separate effective date. So you might see that section, the same section repeated 3 or 4 times, depending on what changes you're making and the date on which you're making them.
okay, all right. Let's get to the ceiling then.
Okay. So, as Deputy Commissioner Gray just said, the governor goes to 400% for CCFAP. Your bill goes to 425 and 23. And then 450 and 24. Which you heard yesterday, if you remember this chart,
24 or 25?
fiscal year 25.
Yeah, fiscal year 25.
July 24.
Yeah.
So to say it differently, you'd go from the governor, and both your governor's proposal and your proposal would be fiscal year 24. And then going to 450 would be fiscal year 25. What you heard from Joyce Manchester yesterday shows that under the current CCFAP rates, using the 2022 FPLs, when you hit about 475% of FPL, give or take, that's when the copay that you out of pocket pretty much equals the total payment. So there's no more subsidy needed. I talked with her a little bit about what about the language of doing either just saying, up to 475 or something like that, or your copay is equal or some kind of language versus just getting rid of the cap. And there was concerns about getting rid of the cap altogether because there's concern that providers might just keep increasing their rates to try to, so you have to be careful, not accusing them of anything, but there is that concern. So you might want, so you could consider, it would be more money, but you could consider going to 475 based on conversations I've had with folks about concerns about cliffs and other stuff. Again, this would be current funding, the current costs. Because the way I look at it is you have I look at it in my brain, and it's two knobs. You have your CCFAP and your, this is the consumer effect. And then when you do cost of care and salaries, that's the provider effect. And so when you start adding more, when costs to the system are increasing, then it's going to change the CCFAP and the clips. So you have to, I know you're constantly thinking about this as well. So this is only under the current system, not under a increased cost system where you have top cost of care taken into consideration.
But it doesn't preclude us from doing making a change this year, 2024, and then the evolution of this is going to be gradual.
All you're doing is expanding the governor's proposal. Governor's proposal is to 400, you'd be taking it to 450 or 475 or whatever else you're doing.
500, I mean, we could set a cap at 500 and see where you could do it at 600. I noticed that
I don't think that's necessary.
600 is just like
You could say
huge.
up to 500 or
Yeah.
co-pays equal cost, or co-pays equal a certain amount, or CC or something.
Yeah, so I've been looking at this graph because it does seem to have the benefit of the relief that we're looking for in terms of the slope. So,
Going to 600 won't do anything.
huh?
Going to 600 according to this chart won't do anything under
Yeah,
the current
no.
system.
600 won't do anything, but up to 500 might do something.
I mean, the logic in the bill was to gradually go
Yeah.
there, and that's why, we would have gone to 500 had we had another year, we could have drafted in there. I think jumping up from 350 to 500 in 1 year is going to be expensive.
But, I think aspirationally, going up to 475 or 500 is a good thing to do, and then allow for, because if we did that, what would be the prediction of the amount of money that we would have to raise? I mean, the governor's budget already has 41 point something $million.
I'm not going to give you a number,
Okay,
but I'll tell you it will be double-digit millions. It will be,
approximate.
you're not going to hold me to it.
No,
You're gonna say it live on
this
YouTube.
is a draft number.
The
This
draft-
number
The
is a
draft number,
number.
I would say between 20 and 40 million.
Okay,
I'll give you a
so
range
Additional.
on top of the governor's
on top of the governor.
41 plus. That was his whole proposal is 56. And I'm assuming his full 56.
So if you look at the Rand report had much more.
We're just talking CCFAP.
Yeah,
Right,
I know.
so
That's
the
what I mean.
Rand report took into consideration
I
the
understand.
salary and the cost of care stuff.
I understand. So, but it will still be below that.
Oh, yeah.
Yeah, okay. So Senator Waits.
And he works for the legislature?
I work for
Yes,
you.
he does. He's
So
I'm on your
he's
team.
our
Who works
money
for the
man.
government? Who's coming up? Okay. All right.
The governor's budget speaks for the governor, and so they just presented to us what's in the governor's budget. So it goes up from 350 to 400. And we have heard from childcare folks that moving beyond 400 in the 2024 year is beneficial to families. And so that's where we are in that conversation. It's not that we don't like the governor's proposal. I am absolutely thrilled that the governor has included such attention to childcare. I mean, it's really an opportunity to be collaborative in this whole process. So, but the question is, what more might we be able to do to take it another step and aspirationally get into 2025? What recommendations can we make? Not that we can't find another legislature. Go ahead. Yeah.
I guess I would be concerned about going up to 500 with one big jump without having also factored in the total cost of care and the increase in pay. Because I could see a scenario where we go up to 500 and then we're like, oh, we can't afford to do the other stuff. And we never do the total cost of care and the increased pay. So I think they both need to be phased in slowly in order to be able to afford them. And
Okay,
even though I do see the 500 as is that's in under the current reimbursement structure is where we don't have the big cliff. I get that. I spent a lot of time looking at these numbers, but I also think that we're not phasing both of them in at the same time. We're gonna do one and not the other, and I worry about that.
okay, all right, we hear you, and now I'm gonna turn to Senator Bullock. Any comments from you at this point?
I think I agree with Ruth. I think the 500 is aspirational and we should be, that's where we're going, but not right away. Because I do think we need to look at those other factors.
So, okay, and I'm gonna suggest that if we had 500 as a cap, it doesn't mean that it's gonna get there, because it has to go to finance.
Sorry.
It needs to go to finance, and it also needs to go to
We'll
appropriation.
also tell you that calculating the CCFAP is a lot easier, but it can't do the cost of care because you need to define it.
No,
Right, and that, I mean, I think that's part of the work that needs to be done, but before we can figure out how much all of this costs and.
but that, if you say the cost of care and it may well increase it, but you don't know how much. And so, right now, I'm looking at a graph that says that 500 might not be so bad, and that might need a cap that we can use.
Well, how much is 500 for a family of 4? What is?
Family of 3 is what I use, so I'll give you both. 500 is $124,300. Family of 4 is $150,000. Remembering that the cost per child, of course, is 17,000 something. So. Say
And
two
what
kids.
is the median income for a family of 4? Do you remember now? By any chance?
We don't know.
Because I also think we have to be sensitive to what that income level. I mean, $150,000 sounds like a lot of money.
If you have 2 kids,
Exactly, it is. I mean, it's more than most Vermonters make.
oh, I know.
And it's,
But it's also, if you have 2 kids, it's more than $34,000 a year for childcare. So subtract that.
We do have to recognize, as we all know, childcare is a period of time. It's
Yeah.
something you've got to plan for, and it's a short period of time. And, it's good. Every parent is going to take a hit.
I know, I hear that,
It's not
but
up to the state to take care of, every family's childbearing decisions. It's a short period of time, it's a hit.
no, but what you hear is that people delay having children or don't have them at all because
Sure,
they don't have another one because childcare is so expensive. And for most, I would say, most families, the issue, until we start talking about this publicly, the issue of having to pay money to take care of your kids so you can go to work and earn money so you can take care of your kids isn't even the realm of thinking. So recently, it's become more and more in the realm. People who have one child and then say, "Can we afford to have another one?" Look very closely at the cost of child.
that's the issue.
Yeah, so it's just like it's complicated. Wait,
and it
let me
also.
say that it's more complicated. Yeah.
It also happens at a time of people's lives when they're making lower amounts of money, and
We all pass through that.
it is incredibly, and it also impacts their future ability to raise money, and it almost always impacts the female member of the family household more than the male. So there are all these other factors that make it really important that the state, that we as a society support people who have kids.
I understand, and again, we've all passed through that phase at this point. It's enormous. And, but again, we meter it against what that income level is, and $150,000 per year for a family. Okay, that's, south of that. It's gotta be, the optics and the reality is, it's south.
Right, that's why I brought up that we need to be conscious of what that means and where we're setting the level, especially before we have all the information about the total cost of care and the salary part.
I think we
Yeah.
agree. We just-
Yeah,
So what I'm gonna suggest is, this is a good conversation. This is excellent. And what I'm gonna suggest is that we stop for now. I'm not hearing anyone who has brought up the 185, the floor, for those who are paying zero copay. So I'm thinking that 185 is something we should be doing. And then we're gonna stop here. We'll come back to S56 tomorrow morning. And we'll try to begin with this and get to some place where we're.
May I ask one question?
Sure.
To interrogate the
Go ahead.
the governor's opinion on 185 versus the current lower level floor. Did the governor have an opinion on the raising of the lower level? To 185?
It's not a part of the governor's budget.
No,
Raising it
or
from
no?
150 to 185.
you'll get used to that answer.
Okay, so we have another bill that we're looking at, S18. Let's take 2 minutes. Thank you, Nolan, and thank you, Katie.
Nice to see
Thank
you.
you, everyone. 2 minutes, and I'm serious about this, so.
We go on.